I'm Dr. Neil Galindez. I practice at HCA Florida Heart and Vascular Care. Coronary artery disease is an illness that comes with something called atherosclerosis. Atherosclerosis is the hardening of the arteries, and this happens with time. Some patients tend to accumulate fat and calcium in all the arteries in the body, including the arteries that feed the heart. These are the coronary arteries. When the plaque builds up in the coronaries and the lumen of the coronaries decreases, then there's going to be problems with the flow. The muscle of the heart is just as any other muscle in the body, so it needs proper blood flow. When this plaque is enough to obstruct the normal flow to a portion of the heart, that portion, that muscle of the heart, is going to starve from blood flow, and the patient is going to feel it in the form of chest discomfort, chest pain. When the damage to the muscle is permanent, this is what we call a heart attack. What we do as surgeons is, after the patient is diagnosed in usually the hospital and the catheterization lab by our colleague cardiologists, we study the films, we see how many arteries are affected and whether or not if a surgical intervention is of benefit to that patient. Usually, if the 3 out of the 3 main arteries are affected, that's a clear indication for patients to undergo cardiac bypass surgery, or CABG as we call it. And what this entitles to is an incision in the front of the chest. We take arteries that run along the chest wall and veins that are in the legs to make the jumps or bypasses that are going to serve to reroute the blood, bypassing the obstructed artery in the heart. If you can imagine that your heart is right in the center of your chest, pointing to the left, the main artery coming out of the heart is the aorta. So what we do as surgeons is get segments of veins from the legs, sew it to the aorta, and then sew it beneath the point of obstruction in the heart. That reroutes the flow into that segment of the heart so it can reestablish the regular flow. This could be done with veins and with arteries. Doing that, the patient recovers that regular flow, can recover the function of the heart, and it can continue with a regular lifestyle.